But to kick off the afternoon session here, we have Frank Nygaard. He's the Senior Technology Partner, Global Business Development at NNE Pharma. And Frank's presentation is where does biotech flexibility matter? And he's going to present a few case studies, 12 as a matter of fact, in flexible facilities. So without further ado, here is Frank.
Yes, hello, and thank you for the introduction. It's a pleasure having the opportunity to present a case study. It's actually only one case study, but it's based upon 12 facility designs that we have been involved in. So what I'm going to do is I'm going to do some extracts and try and get some learnings and some trends for what we have seen from these 12 flexible facilities. It's also a pleasure to give it here at Interphex because it gives the audience an opportunity to go and look at the different suppliers that can help you set up flexible facility, because most of them are actually represented at this event. But to get started, I'm from NNE Pharmaplan. NNE Pharmaplan is an engineering company that is born out of Novo Nordisk. So it used to be the engineering department of Novo Nordisk, and it's been around for about 85 years. But about 25 years ago, it was separated out as an independent company. So now it's a company that has a global reach. We have headquarters in Denmark, and then we have offices in Central Europe, in the US, India, and China. So we have a global presence, actually. So due to that, we actually have done a lot of projects around the globe, and that's what I'm going to present today, some of these findings. So it's going to be, and I'll show you a map in a minute where we have taken these projects from, but it's going to show you if there are some trends on a global scale that can be extracted from these activities. NNE Pharmaplan has got around 2,000 employees, and as mentioned, they are scattered all over the world. We have half of the people located in headquarters in Denmark, and then we have them spread out in Asia and in Americas and Central Europe, as mentioned. We're doing about 3,000 projects on a yearly basis, and that goes from very, very small projects done by one man up to very big projects done by a whole team of 1,500 people. So, NNE Pharmaplan is focused on pharma engineering. So what that means is that we have about 99% of all our activities are concentrated within this industry. And this word cloud is just to give you some ideas of the areas that we are engaged in. And what I'm going to do today, I'm going to focus on some of these activities, and that has to do with facility design, has to do with manufacturing strategy. We'll look into single-use technology. This is a very central element in the flexible facility that I'm going to address today. Production capacity, that's very important when you talk about flexibility. How can you actually adjust your capacity? And then technology integration, how does that fit into integrating new technologies? So, just a short agenda. I'll briefly go into the new pharma reality as we see it at NNE Pharmaplan. I'll go through the basis for these 12 flexible facilities that I'll discuss, and then we'll do the extract from these in the end and do a summary. But the new pharma reality, what does that mean? And we have done some investigations. We have been asking our key clients, how do they see the new pharma reality from their side? And one of the quotes that we got back from this analysis is placed up here. And basically what it says is, suddenly you get a new product and it needs to be up and running as fast as possible. This is something that we see in many companies. And this is just to give you an illustration of this. Here's a list, and you can't see the details, but it is the leading pharma products that's out there. It's the 50 leading growth drivers within pharma. And they have then been organized according to how they have been sourced into the organizations, whether they have been internal development, whether it's been acquisitions, or in-licensed products. And if you do an analysis and see how many of these products have actually been acquired through acquisition or in licensing, we see that about half of the products of the leading growth drivers has been acquired into facilities in a late stage. So that puts some strains on the manufacturers of these products. Some other quotes that we obtained from this analysis is, well, we may have been seen, and we see still, a need, of course, for large quantities, but we do see an increasing need for quantities not in the tons, but maybe in the hundreds of kilograms of API. At the same time, we have seen during this period that the titers has gone up. So with this amount and with the increase of single-use technology being available, you see an opportunity to start producing out of single-use technology, which gives you a lot of flexibility. We also see some of the customers that are getting engaged into the biosimilar business. This has been relevant for emerging markets for many years, and it's also becoming relevant now in the US with the first approval of a biosimilar. So what these companies, especially in the emerging markets, have been facing is that they have a cost and they have a risk that they have to take on their own shoulders. Another challenge of tomorrow is that it is very important that we have an agile way to respond to the changes in demand. There are so much uncertainties. So that means customers, they need to be able to produce material, and they need to respond in a very fast and flexible and agile manner. So that kind of extract a number of keywords that we can take out from this analysis, and that's highlighted here. It has got to do with the amount of material. It has got to do with what kind of equipment you're using in order to create flexibility, to get into the biosimilar space, cost, risk, and the changing demand, which requires a lot of agility. So this is kind of what we are focusing on these kind of flexible facility that I'll present today. So one of the key enabler for flexible manufacturing is single-use technology, as just mentioned before. And just to give you a visual impression of this, I have a picture. I have a picture from some of the work that we have done from one of our major clients, where they had a request to have a single-use bioreactor installed, but they also had a need to keep an existing single-use system just side by side. So this gives a very good impression on what we're talking about when we see single-use technology relative to the old stainless steel solutions, where we have a system which may be either attached to the wall and fixed, and a system that you can move around, flexible as you need it. So that's one of the key drivers, single-use technology. It will decouple your process from the building. There's no complex distribution matrices because all the connections you're making are flexible. Media and buffer supply, they can be adjusted to your needs, and they can be expanded also as you need it. And one thing that is very central is you can start small and then you can grow big. If we look at some of the important factors, that has got to do with the cost. So what does it mean by going in single use? It means that your investment cost may actually be reduced depending upon the amount of single-use technology that you implement. So here's a calculation of the cost that you're saving, cost savings that you'll see, and that can be up to, say, around 30% depending on if it's fully single-use implementation you do. That's here. So this is on the second slide or second graph here. You see that the investment cost reduction is about 30%, and that is also due to you actually have less requirement for the area that you need. But it does come at a cost. The operational cost is affected, and what you see is roughly, say, around 50% increase in the consumable expenditure. So it doesn't come for free. So how do we do an analysis on if it's relevant for a customer to implement single-use technology? You have to look at the capacity that you need. And if we do a calculation based upon current standard titers, and that would be for monoclonals around 3 grams per liter, what we see is, by doing a simulation, that if you are in the 100, 200, maybe 300 kilogram scenario, you actually, even including the operational cost increase, you see a benefit for going single use. If you're going above, of course, stainless steel might be a solution that would be the right for you. However, there's another point, and that has got to do with how well do you utilize your facility. If you start up and you're early, early launch or maybe first year on the market, you may have some uncertainties about the capacity utilization, and that would again favor single-use technology because the cost is linked directly to the amount of product that you produce. So with a lower facility utilization, you may even see a benefit for higher capacity installments that can point to single-use as being more attractive. So what we have developed is a flexible facility concept. We call it Buy on Demand, where we basically take the different functions and group them together. So you may have raw materials that you group together. You have solutions, you have your process, and then you have your support. So with this, I'll just run through a traditional process where you have a seed lab, you have a cell culture and harvest area, you have purification, and then you have your final purification and filling area of your API. So this is our flexible facility concept, which is then supported by media preparation that can feed media directly into your cell culture. And you have your buffer preparation that will feed directly into your buffer preparation area. So that brings me to the data set that I'm going to present today. It's based on the buy-on-demand concept with flexibility as key driver. And all facility designs that has been presented here is based upon not a single product, but a multi-product design. One inclusion criteria for this analysis has been that it must be produced out of a single-use bioreactor, but other processes and systems may be single-use or it may be stainless steel, thereby creating hybrid solutions. This is a map showing where the case studies or where the facilities has been designed for, and you see that it's represented by Latin America, Central Europe, Denmark, Russia, and then there's a huge intensity going on in Asia, and this is just a subset that has been selected. This shows the 12 different facility designs by when we have actually had the basis of design, and that's from 2011 up to 2015 this year. The design has been selected, so there is a representation both from commercial designs that has been made for pilot and launch. And this pie here shows our involvement at NNE Pharmaplan, and you can see that half of those have been where we have done the basic design, and then we have 1/3 in detailed design phase, and then we have 1 EPCM and 1 conceptual design phase. So that brings me to the data. So what has been the process, the basis for the manufacturing? And what you see here is that it may be either, we call it protein, or it may be MAP. So if it's protein, it can produce mammalian cells, and it may be for MAPs, but it may also be for other therapeutic proteins. And what we have is about half of the designs has included mammalian products that has not only been MAPs, but also other therapeutic proteins. And then about 42% of those, and another 42% has actually been designed only for producing monoclonals. It doesn't mean that it cannot produce non-MAPs, but it has been optimized for MAP production. The batch size that we see is based on the pilot scale. We see 500 to 1,000 liters. If you go into the launch scale, the single-use bioreactors has been 1,000 to 2,000 liter scale. And for the commercial scale, we see that all has been out of 2,000 liter bioreactors. And the note that I made there is actually to show that about 1/3 or 2 out of the 6 commercial designs, they have actually requested a design that allowed pooling from more than one single-use bioreactor. So up to 3 bioreactors may be inoculated using the same seed material and is then pooled together and processed as one 6,000 liter batch. The manufacturing strategy has been based mostly upon campaign-based manufacturing, but we have seen too that is concurrent manufacturing. And what we mean by that is whether it is okay to have more than one product in the upstream area at any given time. And what we see is there's actually a geographical difference or prevalence for this. All the emerging markets that we have done have been manufacturing on campaign-based manufacturing. So even though we're talking about closed systems, it is generally not accepted by the local regulatory authorities to produce different products in the cell culture. The two concurrent manufacturing scenarios that we have is both from Europe, and I know that would also have been the same case here in the US, where it's also broadly accepted to produce different products in the cell culture area at the same time. So, if we run through the manufacturing, for a typical mammalian production, you would have a seed train, and that might be, say, 4 weeks. And then you have the main bioreactor, which could be 2 weeks, give and take, plus and minus. But this is a very general schematic representation, and then purification would be 1 week approximately. When we design the facilities, we design a seed lab and we design a cell culture. And what we typically see is that the seed lab would account for 2 to 3 weeks of the initial production. And then you have the cell culturing that would be, of course, the main bioreactor, and then typically also the seed reactor, the N-1 for the main bioreactor. And why I bring this up is that has got to do with how do you do the design of your facility in order to support an optimal utilization. If you have a cell culture time of 3 weeks and you have a downstream of 1 week, if you have batch or campaign-based manufacturing, you're not allowed to have different products in the same room at the same time. So that means when you do a changeover, you kind of lose some time. And in a pilot, you have frequent changes between products. So that means that the design request has typically been asking for having more upstream rooms, cell culture rooms, relative to the downstream room. That's actually the opposite for what we see in the concurrent manufacturing. Because in the concurrent manufacturing, you may have systems that would allow you to generate material that cannot be processed in downstream rooms one-to-one. So in order to have the optimal utilization of your bioreactors, you then design 2 downstream rooms. This is what we have seen in the 2 concurrent manufacturing designs. Then there's also another thing about the construction methods. And what we have seen is that all of these 12 case studies have been stick-built. There's a lot of debate ongoing whether you should have modular construction or stick-built. And we did actually evaluation in 2 of these cases, and both of those turned out to be in favor for traditional stick-built model. That has, of course, got to do with where you're building, in which location and the area. But at least what we see still is that stick-built is the preferred construction method. If you look at the process design, I mentioned before that you have the seed lab, you may have the cell culture, the initial purification, and the final purification. But there's also a lot of debate ongoing about the ballroom concept. And what we see is that even though it has been around for some years, the ballroom concept and the discussion of whether you can do cell culturing, initial purification, pre-post virus in the same room, because in single-use systems, you are running closed systems, it is not something that we include in the design so far. We have only one example where we have cell culture and purification in the same room, and that's a facility that has been designed for local manufacturing that was not meant to be for Europe or for the US market. If we look at the clean room classification, seed lab, it's open handling. So we see in all the designs that they have been based upon an ISO 7 Class C clean room. The seed cultures, and that also goes for all the designs, they have been on an ISO 8 or Class D. But if we look at the initial purification, they kind of cluster into 2 different clean room classifications. So there's either ISO 8 or ISO 7. And if you look at other trends, and that's definitely a trend that we see, because the local authorities, if you go to China, if you go to India, they would say that they would need to see a Class C or ISO 7 in all the purification steps. If you go to Europe, if you go to Brazil, what they would expect to see is ISO 8. That's okay, that's fine. If you go to the final purification, then all of the designs have been designed for ISO 7 or Class C, because that gives the manufacturers a possibility to go outside the closed systems if needed. That brings me to the single-use implementation. And if we look at the upstream and the downstream one by one, then the bioreactor is obviously 100% because that was the inclusion to be part of this case study. But then we see that we actually have 1/3 of the cases where we have a hybrid solution, or say the other way around. It is only 66% where the harvest is single use, which is depth filtration. But we see that in 1/3 of the cases, centrifugation has been implemented. And that directly links into the size, the 2,000 liter bioreactors, and the limitations of the depth filters, because that very strongly influences the cost of manufacturing these products. If you look at the media preparation, we also see that as you go up in size, we see an increasing trend to favoring going into stainless steel. So in 25% of the cases, we have actually hybrid solutions for the media preparation. But then coming to the hold systems for the media, we are back into single use, where we only have one case where they want to have stainless steel solutions. The same picture is actually the case for the downstream, where we see the intermediate product holds. In all except one, they are in single-use systems. If we look at the buffer preparation, we have the same trend. If we go up in size, then people or facility designs has been made so that 25% actually includes stainless steel solution. And then when you're back in the whole system, all except one is in single-use system. One thing, though, that you can note is the process equipment. For the process equipment, we see that only 2 out of the 12 cases have implemented fully single-use, meaning that the chromatography and the TFF skids are single-use systems as well. So that kind of indicate that even though there's a trend for single-use systems, it is not fully embraced in the downstream equipment yet. In order to see if there's any trend in the single-use versus the stainless steel solution, if you look at the bioreactor sizes, we see that in 1,000 liter and 500 liters for the process, all of them are single-use systems. If we look at the 2,000 liter systems, there's a split. About 50% of the systems for the process will be out of a hybrid system, and that's mainly, as shown just before, in the media and the buffer preparation systems. And then the other half of the 2,000 liter design is a single-use design. This one shows again that for the media and the buffer preparation, the prep vessel is again the stainless steel solution. And if we go into the media and buffer hold, you see that the single-use system is the system that is preferred in all cases except one. So, facility design for the capacity expansion, we have a facility design which is based upon self-contained functions. So you can basically duplicate, or you can expand in different ways. And what I've tried to illustrate here is the way that we see that this expansion has been done. And one way is equipment swapping. And what we mean here is that you start out with one size of equipment, and then at a later phase you replace this equipment with a larger size. That means you could start out with a 1,000 liter and end up in a 2,000 liter. Another way of doing expansion is by simply fitting out. That means in the design phase, you leave enough space to include more equipment. So you could start out with one bioreactor of 2,000 liter, and then you can end up with 4 or 6 times 2,000 liter bioreactor. The last way of doing expansion that we see is by having drop blocks. So basically, since they are self-contained units, we can allocate space and we can design all the support systems to allow additional blocks to be added to your manufacturing facility without influencing the current production. And if we look into how that distributes the capacity expansion strategy, we see that equipment swapping is what we see in about 1/4 of the cases, and that's, I would say, mostly related to the pilot scale, where you may start out even at 200 liter, go to 500 liter and maybe up to 1,000 liters. The fitting out is by far the most preferred way of expanding, meaning that you would start up with a set of 1 or 2, a pair of bioreactors, and then you can go up to a 6-pack, for instance. And then the drop block, where you allocate space in your building, you have a sandbox, more or less, and then you, when needed, you can add this extra block and increase your capacity in this way. And what that means is that by selecting between these different options, we see capacity expansions between 100 and 400%. So that brings me to the final part of this case study, and that's the flexibility technology integration. So all of these has been based upon fed batch production, but what we see is that there is an interest in also being able to produce out of a continuous processing. So what that means is that, and maybe you can't see it here, but the big blue block there represents the drug substance manufacturing. What we have requests from in the design is that that should actually be able to swap between being fed batch and continuous manufacturing. We also do see that fill and finish is something that is requested for many of these designs, and we have actually designed into approximately half of these designs have included that flexible facility should be able to add to these designs. And then finally, we do also see ADCs, the antibody drug conjugate, these new types of products. There's also requests, not much yet, but there is actually starting to appear requests of including opportunities for doing ADCs in these flexible designs. So that brings me to the summary of this case study where we looked at the 12 designs. Single-use technology is definitely a key enabler for these designs or flexibility. The hybrid solutions, they are definitely most frequently seen in designs for commercial production, which is not surprisingly because that's where you need the large volumes of solutions. A traditional layout for upstream and downstream is still seen in basically all the designs. We only have this one ballroom concept out of these 12 case studies. The expansion strategy, that is included in all the designs, that includes single-use technology, and that gives you the freedom to respond rapidly and agile to these increase in demands or changes in demands. And then the design, as you saw, we had 4 cases where continuous processing has been designed to be implemented into the facility, and actually given to the fact that the process equipment have not been attached to the wall. As new technology evolves, they can relatively easily be implemented into these designs. So with that, I'd like to thank you for your attention, and if any questions, I'll be happy to take them.
Okay. Thank you. That was really informative. You mentioned the design for new technologies. When it comes to actually transferring new technologies in where your development labs may be in a remote location from your commercial facility, what sort of techniques have you seen across any of the facilities involved in those case studies? What approaches did they use in your experience?
Could you repeat the question, because I think the speakers are turning the other way?
It was just around how new technologies are introduced and transferred in to some of these facilities involved in the case studies. Did you see any examples where the development labs were in a remote location from the commercial facilities, and what considerations were made to be able to, effect a more seamless tech transfer in the design?
So actually, most of these case studies have been out of new entrants, new players. So they would generally have had technology from existing suppliers. So they would have deals with CMOs or other manufacturers of these processes, and that's why we have not been engaged in new technology. Outside of that, they just have had requests. So if they want to go into continuous processing, because it is a big trend now, what does it take with respect to delivering of solutions, media, because there's a significant increase in media preparation, solutions for high titers, how much buffer solution should the utility system be able to support? So this is the level of engagement that we have had in these designs. Okay, so for the first question, that was related to the long-term cost analysis of single-use system versus stainless steel solutions. And what we have done is, it's not usually something that we do, but when we have done it for clients, we have expected that we have discussed about utilization, and then we have done the cost analysis and taken into consideration depreciation of the facilities. And that means that over 10, 20 years, depending upon whether it's building or equipment, we have factored that cost into the calculation. So what we can, the cost calculation that I showed you there is actually taking that into consideration. So if you are at about 200 kilogram scale, if you have a system that is a model system, there's about a break-even point. But then again, it really depends on, do you have systems available on site already, because then you have maybe less investment, and then you may be able to do some cleaning systems that would be could be of a less investment relative if you're starting a greenfield project. So it really depends where you're starting from, and it's also a strategy from the manufacturer, because it's not only a cost issue, it's also a matter of utilization, changeover times, and validation. If you have many different products, do you need to validate each new product that comes in? So there's a huge strategy that's behind it, not only the cost of goods analysis. And the second question was, so what we are using in this feasibility study is a commercial product which is called Biosolve, which has been developed by Andrew Sinclair out of Biopharm. So that's a commercial product that is out there that has built in some of the cost for consumables, and it also factors in the cost for cleaning and labor and analysis. And then, if needed, we can go in and adjust it to local conditions. But as a first shot, we use this model. So,
thank you.
Okay. Okay. So, thank you for your attention.